Someone was asking why performance drugs like stimulants are being given to children when their brains have not finished developing.
Your brain doesn't finish developing until about age 25, right? And if you have an ADHD brain, it's going to lag by about 2 to 3 years. And there's some evidence to show that taking a stimulant works in a positive way in terms of brain development. They're talking about those things, and it does not impair brain development. Okay, that's important. Okay, and so you look at the upside of treatment, okay, versus the downside of treatment. Okay, the downside are a few side effects. The upside is absolutely huge in terms of success in school, socially, and also in the workplace. There's another thing that you have to talk about here, and that is the downside of no treatment. There's no upside of no treatment. Okay, what is the upside? You don't get side effects. Okay, yeah, okay, that's a bit of a blip. What's the downside of no treatment? The downside is the fact that there's about a 40% chance you're going to develop a substance use or alcohol use disorder by the age of 15. There's a good chance that 30% of the individuals will not finish school or experience failure. You start to look at teenage pregnancy. You start to look at over 50% of individuals with the disorder, their marriages will fail. Frequent job changes, goes on and on and on. So there is a real downside to not treating. And the other thing that we have to be really concerned about is this mortality study that the Danes did in 2015, looking at ADHD and comorbidity, where premature death goes up by a factor of 8 if you have ADHD, oppositional defiant disorder, and a substance use disorder. Bad news. So we have to talk about if you don't treat, then you have to accept the fact that you are going to end up with a really tumultuous various stages as you move through the lifespan.